Did you know that cervical cancer is almost entirely preventable with proper vaccination, regular screenings, pap smear, and HPV testing? I don't know how that makes you feel, but it makes me feel some kind of way to have so many women diagnosed with cervical cancer when it can be prevented. We're talking about it on this episode. You're listening to the PHEC podcast, episode 338. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. Every month, a diverse panel of innovative public health thought leaders come together to discuss public health topics during a live stream that we host on LinkedIn. Now, after the event, we summarize and share our takeaways with a newsletter article as well on LinkedIn. But I also take a step further and I bring that conversation to you here on the podcast so that we can distribute it broadly across all of you who are not on LinkedIn or who are on LinkedIn but maybe did not catch that recording. So during January, we focused on cervical health awareness. It's a women's health topic. It was actually National Cervical Health Awareness Month in the United States. But as I often say with these awareness months, it's not just for that month. I think it's something that we need to be highlighting across every month of each, throughout the year. But it does give us a time to focus on it and to bring more attention. So regardless of when you're listening to this episode, it is relevant. This provides us, like I said, with the opportunity to share across these topics whenever it's convenient for you to pick up and listen and continue these discussions. So this conversation, this topic I was joined with these innovative leaders, Erica Horn, Kristi McClamroch, myself came together to discuss this topic, and a lot emerged during the conversation. I really enjoy the roundtables every time we do them, and a lot of people are giving us positive feedback on them as well. So let me connect that conversation with our panelists, and then I'll come back and we'll recap and share takeaways. Welcome, welcome. This is our first Roundtable Live for 2024. I am excited to be here with this group. We've been kind of chatting, getting ready to go live backstage, a little virtual stage. And thank you all for joining us. So if you are watching for the first time, wondering, who are these people? What are they doing? We are excited because every month, the first Wednesday of each month, we host the Roundtable Live, Public Health Roundtable Live. And we have a different topic that we focus on for the month. We share our insights, thoughts. We host a discussion. So if you're joining us live, we want you to comment in the chat. If you're watching the replay, we want you to add your comments in the chat because we will revisit the newsfeed and the stream and the comments afterwards. We continue to follow up and keep the conversation going. So I am asking you in the comments, you can, anytime you want to add in, please do so. Introduce yourself, comment, and carry on back and forth. And also share this. So you can automatically just click the share button right now to your newsfeed so that your network can also join in on this discussion. My name is Dr. Charlotte Huntley, and I am the CEO of Dr. C.H. Huntley, LLC, which is a public health consulting firm. We are passionate about supporting large nonprofit organizations, especially those that serve BIPOC communities. And we provide all sorts of epidemiology support, essentially helping BIPOC organizations communicate their health information in ways that are easily understood by the communities they serve. So I am also the host of the Public Health Epidemiology Conversations podcast. I have to give it a little shout out for the podcast. Brand new episodes every Tuesday since 2017. So we're excited, very proud of that. And I am joined by a phenomenal panel. I'll let them introduce themselves. We'll start with Erica Horn.
Good afternoon, everyone. It is certainly an honor to be here for the first Public Health Roundtable of 2024. I'm Erica Horn. I am the founder and CEO of McCary Consulting, LLC, which is a business where we work alongside faith-based organizations, nonprofit organizations to help them in program planning for health-related events, whether it be like a health fair or speaking engagements. And then we also support governments and agencies with program planning as well as evaluation support for different programs that they have as well. So really community-oriented, community-driven, and really excited to be here today talking about cervical cancer and women's health, and looking forward to a great conversation. I'll go ahead and pass it on.
Yeah, thank you for that, Eric, especially since I forgot to mention our topic. So thank you for bringing that in as well. Kristi, please introduce yourself.
Yes. Hi. So my name is Kristi McClamroch. I am the founder and executive director of Public Health Connected, which is a nonprofit organization that I actually founded during the height of the COVID-19 pandemic. And, we were really focused on supporting public health professionals during that time. I'll actually just mention that I've been working with our new board in the past year to kind of revamp things since the pandemic has shifted. And so we're really focused on public health rock stars now. And we define a public health rock star as someone who is courageous, passionate, authentic, and resilient public health disruptor. So I'll share our new mission. This is actually the first time that I'm sharing it publicly. Our new mission is to create a space for public health rock stars to connect, share ideas, and work together to transform the public health landscape. And our vision is the full power of public health unleashed. So I'm really excited about that. You'll see a lot more stuff about Public Health Connected coming out in the next month or two. And then also something that I am saying for the first time publicly is that I am in the process of writing my first book. So yes, I'm so excited. It is a memoir about intergenerational transmission of trauma. So it's looking at 5 generations in my family and how trauma has been passed down, and how there's also been intergenerational healing as well. So I'm really excited about that. So I've got these both, so we're wearing both of these hats right now, but I love, women's health, very invested in women's health, and happy to be here today. Thank you.
Wow, what an introduction. All the firsts. Love that so much. I know Erica feels the same way whenever I hear public health disruptor. It's like, when I was actually someone first said I was a disruptor, I was like, me? I'm like the rule follower. What do you mean? But certainly fit that category, and very much inspired whenever I hear that phrase, those terms. I'm going to add as a banner to let people know who are popping in and out at different times what we're focused on today. And I'm going to kind of frame the topic. So this is, we were looking at topics and what to focus on in January. I'm going to look over to the side for a moment. I have a little note here. January is Cervical Health Awareness Month. And for a little bit of statistical fun fact, not so fun, but nearly 13,000 women in the U.S. are diagnosed with cervical cancer every year. The disease is almost entirely preventable, and that's with proper vaccination, regular screenings, pap smear, and HPV testing. I don't know how that makes you feel, but it makes me feel some kind of way to have that many women in just the US to be diagnosed with cervical cancer, something that can be preventable. So that's right down the public health alley, right? Where we talk about prevention. But more importantly, before we even get to that topic, just under this umbrella of women's health, I think that all of us have, as women, as we probably are if you think about our immediate circles, family, friends, women are often the influencer in those immediate circles, right? We do lead often in those immediate circles. And that means that it becomes very easy for us to give and serve and be there and thinking about everyone else. And then ourselves, we kind of put last, even when we have the intention. I learned personally last year, I can set the intention to prioritize my health and make sure I'm taking care of myself, but then I'm still not doing as much as I should or could be doing. So I think that's a challenge across the board, which then leads into these types of issues with women's health. So I want us to broaden the category a little bit to women's health, with also this focus of cervical health awareness and that being one element. But certainly this is not the only month for us to talk about it, but I figure this is a good place for us to start. I want to hear from each of you. How does this impact maybe the communities you serve, the work that you do, you personally, the communities that you're influencing? I know that in my work, I work with a lot of, as I mentioned, we serve BIPOC organizations. I do a lot of work with tribal organizations in particular. And when we get to BIPOC communities, these are the communities that are hit the hardest, the first, suffer the greatest. And then when you then add women within a BIPOC community, it's an even greater disparity that's just apparent across the board. So anytime I can hold space for these types of discussions, it's important to do so. And a platform like this one, where I really believe that we should speak openly and transparently and be a little vulnerable and hopefully inspire continued conversation. So I'm going to go to you, Erica, first, and just let you share, how does this resonate with you in any work that you do, like I said, personally or just in your circles? How does this topic of women's health, cervical health affect you?
That's an amazing, great question. Personally, I'm a huge women's health advocate. Those who do know me, and for those that I have been able to support, I have always been the person that's encouraging and advocating and helping other women advocate for their own health in different capacities. I've spoken at women's retreats, at breakfast, different events for young ladies, and just helping them understand the importance of going to the doctor, going to get tested, like getting an annual physical exam, an annual pap smear, because a lot of times that's not something that's discussed, especially within the Black community and within Black women. Also, when you think about the different stigmas that may be associated with like going to the doctors, or just not having the insurance they think they need, or not having access to healthcare to be able to get the necessary testing or be able to have access to a doctor, it can be traumatizing, especially for those when the first time they do go, maybe like their 20s or 30s, and then they're like, oh, well, we found something, so we have to do a colposcopy and, additional tests. And then there's that fear that gets associated with it. So I think really just empowering women at a younger age as much as possible. I know I mentor with a couple different young ladies groups, and part of what we do and what I do as a part of my role is ensuring that we have a health component to our work and our mentorship with the young ladies, and ensuring that they're understanding how to take care of themselves and how to advocate for themselves, because a lot of times they're not receiving that. They're not receiving that education, whether it be in school or, their family members may not be knowledgeable, or they never had access, so they don't even know that's the thing to do. So just trying to find a way to empower women overall to take action in their healthcare is so important to me, because I've seen the power. I've seen how it is when I go to the doctor and if I'm not treated correctly, or I've seen when I used to work clinically. So before I dived into public health, I used to work clinically for years in the doctor's office, and I worked in the emergency room, and I would see how some people were treated. I would see how the patients were treated, especially those that are minorities, those of BIPOC communities. And when they didn't have the ability to advocate for themselves, when they didn't know what to say, they would just receive any kind of treatment. And I know I would have side conversations like, I don't think we should, talk to them like this, or have you considered their background? Like, I was always in a public health mind frame and didn't realize, just like, well, did you consider they may not have had the funds, or maybe they don't have the ability to go to the doctor? This is why they're always in the emergency room. But just realizing that there was a lot of education that needs to take place. There's a lot that needs to be done with advocating for women advocating for themselves, but also understanding how to advocate for themselves. So a lot of the work that I do, I get the opportunity to speak with women one-on-one, whether it's at school, whether it's at work, whether it's at church, and just helping them feel more empowered. But it really is important because, like you said, like you mentioned earlier, we're really nurturers. We're naturally caretakers. We're naturally givers of ourselves. And very seldom do we consider ourselves and our health when we're in that role of caring for others and we're taking care of others and we're trying to teach others. So if we can't take care of ourselves, if we aren't advocating for ourselves, if we're not in a position where we can actually pour into others, we're doing a disservice to those that we're serving. So in order for us to truly be able to serve those that we were created to serve, then we really have to care for ourselves, but then feel empowered to do it. And I really love the ability to be able to encourage others to do that for themselves. So that's kind of what it all means to me.
That's really great. I mean, I loved everything you just said. I think one of the things that stands out is, pouring into young women. And, it kind of took me back to, I was fortunate to have older sisters. And because my when I was growing up, we did not openly talk about, my body and what was happening and changing. And I was shocked at every milestone when I started my period. Can we talk about this on LinkedIn? I don't know.
Yeah, right.
I had no idea what was happening to me. And I was like, how long is this going to last? And my mother said, a long time until you're like in your 40s. And I was mortified. I thought, oh my gosh, every day for the rest of my life until I'm in my 40s. I just didn't know. We didn't have those kind of conversations. So I think being able to, there's cultural barriers, there's these generational gaps, and in our communication with the young girls, pouring into them to help them to kind of raise this awareness of their bodies and get them really early on to understand what's changing and just start to normalize having these conversations, where regardless of the platform, Anyway, I'm not going to hijack it too far, but I had to kind of interject that a little bit. Kristi, I'd love to hear from you on this topic.
I'm like, where's the heart button? Where's the thumbs up button? I can't find it. So I'll just do it myself. Oh my gosh. Erica, so much of what you said resonates with me. And I have a million thoughts in my head now in response to what you're saying. So let me try to put some order to this. So one of the things that I didn't mention in the introduction, but as part of my background, is that I worked in the area of STIs and HIV in the 90s and the 2000s. That was my focus area as an infectious disease epidemiologist. And I was really fortunate to have the experience of going overseas. I worked with commercial sex workers in the Democratic Republic of Congo, in Madagascar, and also in Haiti. And women's health has always been really important to me. That's really been a driver for me. And, having the opportunity some of the time I was in an STI clinic, and women, commercial sex workers, were coming in to get tested. And I had the opportunity to, sit with the doctor while the doctor was doing pelvic exams and looking at women's cervixes. I don't know what the right word is there, which was this really powerful experience for me, because I knew that there is a huge level of vulnerability that is required for a woman to go into a doctor's office and get on that table and have a gynecological exam. That takes vulnerability and courage and strength to do. And, these were women who are at particularly high risk, who were very, very low income, very marginalized as a community. And, that's something that's always stuck in my head, right? And, they were there looking for chlamydia and gonorrhea and HPV and HIV and trichomoniasis and bacterial vaginosis, like all of the things. And so that's sort of a part of my earlier life that was actively working in that area, but something that I always hold with me, that I always carry with me. I looked up a little bit more about what's been happening with HPV and cervical cancer recently. And I just wanted to share, because I'm actually, this was very exciting to me, Charlotte, when you read that, when you gave that initial statistic, right? It has a sort of like gut punch sensation of like, oh, that's, this I find very hopeful. So WHO's goal is by 2030 to have, and this is worldwide, 90% of girls vaccinated by age 15, 70% of women screened with high quality tests between the ages of 35 and 45, and 90% of women with HPV and cervical cancer to get appropriate treatment. And that was really like, that sort of gives me the opposite, like, okay, this is something that is important. It's a priority by WHO. I know that it's a priority in this country, but in other countries as well. And, when I sort of think about that, and then the work that I'm doing with Public Health Connected to really help these disruptors, these rock stars, these like public health, am I allowed to say like kick-ass on LinkedIn, kick-ass public health, professionals to get in there and like, let's do this. Like, let's make this happen. This is, that makes me feel hopeful. I know it's not an easy goal, but I'm really glad that it's there. And I believe that it's possible. The other thing I wanted to say, Erica, is this idea of advocating for young women and teaching. I would say, just as important is teaching young women how to advocate for themselves, like empower them, give them the power. That's really important to me as well. My daughter is 17. And so it's been very much on my mind, how to teach her how to advocate for herself and, advocate for herself in all the arenas of her life, but certainly with her health, with her medical care, in her sexual health. I think that's extremely important. And to some degree, that actually connects then with this memoir that I'm working on, because one of the things that I think often gets in the way of learning the skills of how to advocate is related to sort of intergenerational trauma. When there's trauma and that's passed down, one of the things that then parents are not always able to teach their children is to, it's self-worth, it's self-confidence, it's empowerment. I think that this impacts women of lots of different backgrounds and ethnicities and ages. But I also recognize that this can be particularly an issue in BIPOC communities where there, for various reasons, like there may be, honestly, this is like true across the board, I would say, where there is like fear and pushback. And it's not that women don't care about their children, because boy, do we care about our children so much. But things can get in the way of being able to sort of be our authentic selves, of loving our children, loving our daughters in particular, and being able to then give these messages in a clear, concise, kind. I'm wearing my kindness necklace today, in a kind way. So anyway, this is all sort of coming together for me with the things that I'm doing. But I mean, I think this is such an important topic. And I'm also someone who, I lost my mom to cancer back in the spring. And so that's also like very close to my heart. So
thank you, Kristi. That was, this is a very difficult conversation to just hold into a short window of time. You all did beautifully with diving in and really touching on so many very important topics and points to highlight. And I think this is definitely, it is definitely a conversation to continue. So I'm going to give you all a chance to just we'll go back one more time and just kind of wrap up and share your final thoughts. I typically try to hold these to like a 30-minute window so we don't spill into, become a distraction on people's lunch breaks or that, stop to watch us. But I do hope that this is triggering some good thought-provoking type of thoughts floating through your head. And maybe you can share some of those in the comment. We have a few folks that are joining us live. And I want to give shout outs. I'm trying to watch my time. So thank you all, but we're going to come back in those comments. And so if you're watching live or watching the replay, share your thoughts. Let's continue this discussion. For me, it is always exciting to host these topics because, like I said, it's a short window of time. And what actually comes out is almost always different than what I expect, but it leaves me with some more to think about, which I really appreciate. Just wonderful feedback shared across the board here. But I think for me, my kind of takeaway is that we just need to continue. There needs to be more of these conversations. I think I heard vulnerability and transparency and those are required to have good communication, good conversations. So continuing with that, Erica, do you have any final thoughts you'd like to share?
Yeah, no, piggybacking off of what Kristi was saying and talking about like just intergenerational things and culture, it's very important that we continue the conversations and making sure that they're culturally relevant and culturally competent. I didn't mention, but I'm Jamaican. So being Jamaican and having these kind of conversations and being from the Caribbean and having visited several countries in the Caribbean, it's the way health is approached is different. So making sure that as we're continuing to do the work, we're making sure that it's culturally competent and relevant to the community that we're serving. And then also ensuring that, I know we discussed a lot about women and their health and their empowerment and making sure that they're understanding, but also making sure that we're including this conversation even with men. And so they're understanding their role, if they have a partner, for how they can be made aware of what's going on and understanding it so they can be included in just the conversation and to know that they're there for their partners. They're there to be able to be a supportive person, depending on whichever role that, the woman may be in. So just continuing the conversation and then not just limiting it, but also being inclusive to our men as well.
Great point. Great point. And what about you, Kristi? What are your final thoughts or
every time you ask me for my final thoughts, it makes me think of Jerry Springer. Final thoughts. You are not Jerry Springer. I am not comparing you to Jerry Springer. Just always makes me laugh. Yeah, I mean, I think, Erica, you make a really good point. And I would even add, HPV and cervical cancer. I mean, these are issues for people who are transgendered, who are non-binary, as well. And so people who maybe others don't think about as also dealing with some of these issues and being at risk. I think it's really important, right? Inclusivity it matters. It really matters. And yeah, I mean, this is great to start this discussion and continue it because there's a lot to be said and there's a lot to be processed.
Yeah, that's a great way to sum it up. I feel that right now. So, well, thank you for joining me. This has been a wonderful discussion here on live, and I'm looking forward to continuing in the comments with our feedback and so forth from those that are watching. So, thank you, ladies. I'll see you next month on the roundtable.
Thanks, Charlotte.
Thank you, guys.
Well, I hope you enjoyed that roundtable discussion as much as I did. Like I said, it's such a great way for us to come together on a platform like LinkedIn and share about public health topics in a very conversational way. We engage with folks that are live and then continue the conversation in the comments for the remainder of the week. And however long the conversation continues. Whenever someone finds that recording and posts a comment, then we receive the notification and we continue that discussion. This has been such a highlight for us across last year, and we're looking forward to continuing to host these roundtable discussions with various different panelists, but sometimes we have repeat guests, which is phenomenal. You get to know each of us even better as time goes on. So if you would like to join us on LinkedIn, the easiest way is to follow our business page on LinkedIn, because you'll be notified whenever we go live. And that business page is Dr. C.H. Huntley. You can find the links on the show notes page for this episode, or also in the description if you're listening to this episode in one of the podcast apps. All right. Oh, one more thing, please do share this episode with a friend, someone that you think would be interested in hearing the discussion and connecting with us. It could be a public health professional, colleague, or a student, or someone who's just curious to know a little bit more about public health. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.